About 5 years ago, my husband Andy and I went through the most horrific time of our lives. Our daughter Tess was born 12 weeks early, and she weighed 2 pounds 5 ounces. We felt helpless during our time in the neonatal intensive care unit because we didn't know anything at the beginning. But as time went on, we learned a lot of strategies to help her. Premature babies get so many painful procedures a day, and watching Tess go through all of that was horrible. She experienced heel pricks and injections and IVs, and there were times when she would get eye procedures that were so invasive that I had to leave the room. So we got a crash course in pain management, and I want to share that with you today so that you could use it for your newborn, whether your baby is premature or not. One of the greatest things we learned in the unit about pain management was simple. It was just skin to skin. Skin to skin is just placing your baby on your skin. I was so terrified to even touch her or hold her for the first time. But when this nurse named Sheila put her on my chest for the very first time, it was life-changing. I actually felt like I was a parent and I could do something to protect my child. I remember looking up at the monitor and actually seeing her heart rate go down when she was on my skin. Andy and I did over 372 hours of skin-to-skin with Tess during painful procedures and at other times, and it was the best medicine that we could have given her. It was something that was easy, and it made me feel like a parent. Another pain management technique that they taught us in the hospital was breastfeeding. I had no clue that that was really important for pain management for all babies. I would put Tess on my breast during a painful procedure when she was old enough to suck, swallow, and breathe. And when she was just little in the unit and on oxygen, we would just put a dab of breast milk on a soother so that she could suck it during painful heel pricks or any other invasive procedures. Another technique that we learned from the hospital was called sucrose. It's just sugar water. And we would squirt it in her mouth before she would have a painful procedure, and it would calm her down. These were like 3 easy techniques that all parents could use, whether your baby was born premature or not. So it's my mission now to make sure that everyone I know knows about these, because babies, whether they're premature or not, get painful procedures, vaccines, hospital visits, and it's really important to share what I know because it doesn't have to hurt.